Good morning, and thank you for your attention. In this presentation, I will focus on a specific population, Black women in the United States, and utilize the macro practice conceptual framework to analyze the challenges, needs, and opportunities they encounter. Building on topic 2, where I examine Black women as an undeserved and vulnerable group, today's discussion will expand and include an identification of the community, analysis of relevant data, assets and strengths, formal and informal structures, and the framing of significant social issues affecting their well-being. My aim is to provide a comprehensive overview that highlights both the systemic challenges and the resilience of this community. Black women in the United States comprise a diverse and multifaceted community. Their commonalities include shared racial gender identities, cultural traditions, lived experiences, and collective efforts toward social equity. Geographically, Black women reside across all regions of the country. However, major concentrations are found in the South, cities such as Atlanta, New Orleans, Houston, and Charlotte, as well as in urban centers in the Midwest and Northeast, including Chicago, Detroit, and New York City. These demographic patterns are rooted in historical migration trends, such as the Great Migration of the 20th century. Culturally, this community is rich and influential, with roots in African American tradition and African traditions. Contributions in music, art, literature, spirituality, and political activism exemplify the cultural vitality of Black women. Additionally, this community provides pivotal roles, offering emotional and cultural support, serving as engines of political advocacy, and making significant contributions to broader and social economic spheres. Data eliminate the disparities faced by Black women. According to the U.S. Census Bureau in 2023, Black women constitute approximately 13% of the female population nationwide. Despite their demographic significance, they experience pronounced disparities across multiple domains. Economic disparities are evident. Black women earn about 64 cents for every dollar earned by white men, according to the National Partnership for Women's and Families in 2022. This wage gap contributes to high poverty rates, with approximately 21% of Black women living below the poverty line, compared to 9% of white women. Health disparities are also pronounced. The Center for Disease Control Prevention in 2022 reports that Black women are 3 times more likely to die from pregnancy-related causes than white women, highlighting urgent maternal concerns. In terms of safety, Black women experience higher rates of intimate partner violence relative to white or Latina women, according to the Institute for Women's Policy Research in 2021. Educational attainment shows progress. Black women are among the most educated demographic groups, particularly in college enrollment. However, systemic barriers such as student loan debt continue to pose significant challenges. These statistics underscore systemic inequalities, inequities rooted in intersecting issues of racism, sexism, and economic marginalization. Despite these challenges, Black women demonstrate resilience and strength. Core values often centered on faith, family, community, and collective uplift drive their perseverance. Historically, Black women have led to social movements from the civil rights era to contemporary activism like Black Lives Matter, which was co-founded by Black women. In terms of power structures, formal leadership includes influential figures such as Congresswoman Maxine Waters, Vice President Kamala Harris, and Senator Raphael Warnock's collaborations with women's and advocacy organizations. Informal leadership encompasses community activists, faith leaders, educators, and grassroots organizers who mobilize local change. Policy initiatives enact this community significantly. Legislation such as the Pregnant Workers Fairness Act and Medicaid expansions in certain states directly influence health outcomes for Black women. Conversely, gaps in reproductive justice policies and the absence of paid leave present ongoing barriers. Black women's community infrastructure includes both formal and informal resources. Formal organizations include the National Coalition on Black Civic Participation, the Black Women's Health Imperative, and the National Council of Negro Women. Informal systems encompass mutual aid networks, family and kinship networks, and church-based support structures. Influence patterns demonstrate that despite persistent systemic inequities, Black women increasingly shape political, cultural, and social disclosure. For instance, high voter turnout among Black women has been a critical factor in recent elections, reflecting their collective capacity for influence and change. Insights gathered from conversations with Black women in my community reveal common themes regarding systemic barriers. Many women describe experiencing a double burden of racism and sexism in the workplace. Others mention healthcare providers dismissing or not adequately addressing their concerns. One individual shared how her grandmother's activism within her church continues to inspire her to advocate for justice locally. These personal stories exemplify his resilience amid ongoing inequities. Among the various challenges faced by Black women, I've chosen maternal health disparities as a key social issue. Maternal mortality is not solely a medical concern. It also highlights systemic racism within healthcare, barriers to accessing quality services, and gaps in social policy. According to guidance from the American College of Obstetricians and Gynecologists in 2021, implicit bias and structural barriers identify significantly contribute to adverse outcomes for Black mothers. I approach this issue by framing it as follows. Black women experience disproportionately high maternal mortality rates due to systemic inequalities in healthcare access, implicit bias, and insufficient policy protections. My working hypothesis is that improving maternal health outcomes for Black women requires a comprehensive, multifaceted approach, including 1, increasing accountability for racial bias within the healthcare systems, 2, expanding access to comprehensive reproductive and prenatal care, and 3, supporting legislation that promotes equitable service provision. In conclusion, Black women in the United States represent a vibrant and resilient community, yet they continue to face systemic inequalities that necessitate broad, macro-level interventions. By using the macro practice conceptual framework, we can better understand both the challenges involved and the opportunities for meaningful change. As social workers, our responsibility is to advocate for justice, leverage within community strengths, and ensure that policies are responsive to the specific needs of vulnerable populations. For Black women, advancing maternal health equity is a critical step within the broader pursuit of social, economic, and cultural justice. Thank you.